Hello, everybody.
Hello. Hello.
If you'd like to put in the chat your name and where you're from or how you heard about this, feel free to do so. Thank you, everybody, for being here. So, February is Heart Health Month, and we like to engage, educate, and empower women on heart health. And we're going to ask everybody to please mute their microphone if they would. Today, we'll talk about the situation, prevention, how to advocate for yourself in the exam room, and some tips for stress relief. The situation. Women's heart symptoms are often dismissed since they are very different from the male experience. Heart attack signs in women aren't always the movie version of that crushing chest pain. Fatigue, jaw pain, and mental burnout can mask physical symptoms. You'll soon see how heart and mental health are interconnected. When we ignore our mental health, our heart pays a price. And when we ignore our heart health, our mental health suffers. Mental health should be prioritized. Chronic stress, anxiety, PTSD, and depression physically damage the heart. Sometimes they cause inflammation or high blood pressure. Depression is both a risk factor for health disease and a common result of a heart diagnosis. The biology of stress, cortisol and adrenaline, keeps the body flooded with cortisol, which stiffens arteries and increases heart rate over time. First, prevention. It's very important that you know your numbers. The 4 numbers that every woman should track include blood pressure, blood sugar, body mass index, and cholesterol. Do you know the difference between HDL versus LDL? If you don't, discuss it with your doctor or check Dr. Google. Are you a person who enjoys eating? It's no fun to be told, don't eat this, don't eat that. You might want to just simply focus on a Mediterranean-ish approach. Incorporate some healthy fats and fibers that support arterial health into your daily routine. Now let's explore the mind-heart-body connection.
Hello, everyone. I'm Dr. Yolanda Hancock, a proud member of the American Heart Association Greater Washington Region Board of Directors. I am so thrilled about our Red Chair series. These conversations seek to inspire and inform women to be strong advocates for their health and well-being and for the health and well-being of women and girls in their lives. Today, I am thrilled that we have Dr. Richards with us to talk to us about the connection between the mind and the body, our mental health and our physical health, specifically our heart health. Dr. Richards, first, tell me about yourself and your practice.
My name is Erica Richards. I'm the chair of psychiatry and behavioral health at Sibley Memorial Hospital, which is a community hospital of Johns Hopkins. I've been here in this position for about 5 years. I also serve as the assistant professor of psychiatry and behavioral sciences for Johns Hopkins Hospital. Outside of my clinical interests, I have a PhD in neuroscience.
We've been hearing a lot more about the mind-heart-body connection, even with research that was presented from the American Heart Association. Can you talk a little bit more about that mind-body-heart connection?
The easiest way to explain this is that the mind, the heart, and the body are interconnected and interdependent. We need to treat the whole patient. We need to be interested in their biological disease as well as their mental health issues and how these two play off each other.
Particularly for communities of color being disproportionately impacted by cardiovascular disease. Can you speak a little bit about their experience in terms of that connection between mental health and physical health, specifically heart health?
We really want to start to talk about other things that we know can influence cardiovascular health, in this case, mental health. Well, we want to understand how to deliver culturally sensitive care. What are the stressors? If we talk about things like the pandemic, well, we know there was increased food insecurity, there was increased job insecurity, specifically in communities of color. We want to be able to refer people to help so that they can pursue not only lifestyle changes, not only getting their blood pressure under control and decreasing those risk factors, but also, if necessary, doing the right interventions for their mental health as well.
Can issues like depression actually cause a heart attack?
There can be increased platelet clotting in patients with depression. Prolonged depression, prolonged mental health issues can contribute to the things that affect our heart function, including leading to heart attacks.
Wow, so you can actually die of a broken heart. Now, one of the things that you mentioned was that there's a difference in terms of the risk of that cardiac issue related to stress between men and women. Can you talk a little bit more about how stress seems to affect women differently than men?
Men and women do experience the same sort of stress, but the question is, what about the other effects of stress and how do they affect women differently than men? If we even take, for example, the circumstances we've all endured over the past 2 years, plus with the pandemic, we look at our circumstances in life. Are we helping children virtual learn from home? Are we trying to take care of elderly populations? Not that men and women both couldn't be doing that, but when you add all of the circumstances together, what we know is that because of these stressors, because of the hormone levels, because of all of this, women are actually at increased risk for this interface between cardiovascular health and mental health that we've been discussing.
Is there any recommendation that you would provide for our community to help people manage their stress?
I think having this discussion, being open to it, being honest about what you're experiencing, supporting those around you that might be asking similar questions is what we want to highlight for the audience. And taking care of yourself, asking for help with getting those follow-up exams, and knowing that there are a lot of people that want to help point you in the right direction is really important.
Thank you so much for your time, your insights, your wisdom, and the work that you do.
This is a longer video, but we'll just take a few minutes of it to see how depression can affect our heart health.
Hello, I'm Dr. Pamela Morris. I have the pleasure of co-chairing this year's Cardiometabolic Health Congress Women's Health Masterclass. And I'm here today with Dr. Erica Spatz, who is Associate Professor of Medicine at Yale School of Medicine. She gave a great talk this afternoon on depression and poor mental health and cardiovascular risk. And I just wanted to start in our chat here today a little bit about discussing the difference or the overlap between stress, depression, poor mental health. What are the definitions, overlaps, etc.?
Thanks for asking about that overlap. So depression is a clinical diagnosis, and there are specific criteria that we use to diagnose depression. It's also the case that many people have depressive symptoms, so they may not meet a clinical diagnosis of depression, but they do suffer from different elements of depression. And these are colloquial terms, but the difference can be important because the prognosis can be different, depending on whether or not a person has depressive symptoms or a clinical diagnosis of depression, where the latter is more highly associated with cardiovascular outcomes. We find also that depressive symptoms as well as depression co-occur with stressful life events, psychosocial stressors. And these can include a stressful life event. They could also include stress in people's home with their relationships, stress at work, financial stress, stress experienced with discrimination. And these are also independently associated with cardiovascular outcomes. So when we think about psychological factors, we want to think about depression, we want to think about psychosocial stressors, And what I also didn't talk about today are other aspects like anxiety, anger, post-traumatic stress disorder. These are all negative psychological attributes that contribute to cardiovascular risk factors and cardiovascular disease.
So let's talk, are there any gender or sex related differences in the diagnosis of depression or poor mental health in the, we'll talk in a moment about the cardiovascular risk, but are there gender differences in the prevalence and diagnosis?
So Pam, we find that women have about twice the prevalence of depression than men. It's pretty remarkable. And if we look at cohorts of people with cardiovascular disease, we see those differences play out as well. We did a study called the Virgo study, which was of patients who were under the age of 55 who had acute myocardial infarction. And on presentation, half of women had a prior diagnosis of depression, as compared with a quarter of men.
Wow. Aren't we lucky?
In a few minutes, I will put a link in the chat for you to copy and paste somewhere onto your computer. And it will also be posted on our Facebook page, Zonta Club of Brewerton, New York, Friends for Equality. It's vital that we self-advocate in the exam room. This document that you will see will give you words to describe pain, clinical words that are very descriptive, far better than just saying, "Doctor, I just don't feel right. I feel off." We'll talk about how to use the pain scale, 1 being from a stubbed toe and 10 being childbirth. You'll read about how to ask the doctor to rule out heart disease, how to ask the doctor to document for accountability. Last but not least, key terms and tests to know about. Certainly, there are many things that we can do for long-term success.
Welcome to Virtual Health's Real Talk Women's Health Chat. I'm Nicole Mahalik from 92.5 XTU, and I am thrilled to be your host for tonight's event. Hopefully, I've seen some of you before. These are amazing events. Always so honored and excited to be here. You're going to feel great, and you're going to learn so much.
So yoga is definitely something that you can do on a regular basis for a long-term solution. You're going to have links to all of these videos in the handout, so you can explore this one on your own. This one is 59 minutes.
We often do a lot of things for a lot of people, but why not give yourself 10 minutes a day to improve your heart?
Your heart is the most important muscle in your body. And as your certified fitness coach, I'm here to teach you how to keep your heart strong for life. My 10-minute heart health workout is designed to get your blood flowing, improve circulation, and strengthen your cardiovascular system with low impact, joint-friendly moves that are safe and effective for all fitness levels. Whether you're looking to increase your endurance, manage your blood pressure, or simply feel more energized and alive, this routine is for you. And don't forget to check out my Patreon community at patreon.com/Caroline Jordan Fitness for exclusive resources to keep you and your heart strong your whole life long.
You don't have 10 minutes? Well, how about 5?
This is your 5-minute no gym workout for better heart health. So it's just going to be a really simple 5-minute low impact cardio workout that you can do just for overall health. Really lovely. We've got 5 moves, and the first move we're going to kind of include really as your warm up. So we're just going to get straight into the workout. Just 5 minutes, you and I right now. So let's start looking after your heart health. Now, first of all, let me just show you a preview of the first move. We're just going to be doing this side step within a punching arm. So let's get ready. We're going to come into position. We'll just start with doing the side stepping and then we can add in the arms. So let's get ready and just step that foot across from side to side. Now when you're ready, just add in the arms, just alternating the arms. So with this, you've got that timer bar on the left that represents approximately 45 seconds. And you can also see here all the areas that we're working. Primarily, we're working your heart, we're working your cardiovascular fitness, plus we're also using these major muscle groups.
So you'll see that it's not too hard. We could do that. Yeah.
There are times when we just need a super quick fix. We feel in the depths of depression, or we feel an anxiety or panic attack coming on.
This one I'd like you to do with us.
The 5-4-3-2-1 grounding exercise helps us get out of our heads by using our senses to reconnect with the outside world and the present moment. So we're going to look at 5 things, touch 4 things, listen to 3 things, smell 2 things, and taste 1 thing. So start by looking around you and naming 5 things that you can see, and say them out loud if you're alone or just silently to yourself. For example, phone or computer.
Did you see 5 things?
Mm-hmm.
And now name 4 things that you can feel, like your mouse or phone or your feet on the floor.
Computer mouse.
And now name 3 things that you can hear, like the sound of my voice or some traffic. And now smell the scent of 2 things and name them. Maybe coffee or the smell of your clothes, or find something near you. Pause the video and go over and smell it. And now taste 1 thing and name it. And if you can't taste anything right now, that's fine. And if you're still feeling anxious or panicky or stuck in your head, take a breath. Inhale and exhale. And maybe stand up and take a few steps. And then repeat this exercise again until you've reconnected with the external world and the present moment. Or you could try my breathing exercise for panic, anxiety, or just feeling overwhelmed.
And to get out of your head.
There are times when we all experience feelings of stress or anxiety. In these moments, you can use your breath to help calm those feelings. Box breathing is a simple relaxation technique that can help you reset your breath and return to its normal rhythm. You can do it anywhere, anytime. Box breathing can help reduce stress and improve mood. It can also help with controlling and managing emotions. It's very easy to learn. Imagine breathing around a box. Inhale as you visualize going up one side of the box, gradually filling your lungs with air. When you reach the top, hold your breath for 1 to 5 seconds as you picture going across the top of the box. Exhale gradually as you imagine traveling down the other side of the box. Pause again for 1 to 5 seconds as you go along the bottom of the box. Then repeat. This can be done 7 to 10 times in a row, focusing on the breath. If you can do it sitting down with your feet grounded, that will help too. But really, it can be done anywhere. Box breathing has physiological and psychological benefits. Physiologically, it regulates breath, increases oxygen to the lungs, and can help reduce blood pressure and lower heart rate. Box breathing can help psychologically by providing focus to your breath and removing attention from the things that are causing feelings of stress and anxiety. The repetition of box breathing can also help reduce stress. So, in moments when feelings of stress and anxiety are overwhelming, remember box breathing and the power of your breath as a simple way to relax and breathe a bit easier.
Well, you may be so relaxed now. I know, that I need to wake you up. And I hope you're thinking about what will you do next as a result of this today? What do you think you will do differently? In a minute, we'll stop the share and you can tell if you'd want in the last few minutes of this presentation. But before we go to that, I'd ask you to get out your phone, and you can either take a picture of this or just open your phone and scan the QR code, and it will take you to the link. It will take you to that document that I spoke about. It's the notes from this event and the links to all of the videos that you saw. There's also the words for what to say to advocate for yourself in the exam room. There's also information on how to describe pain and how to ask for documentation and accountability. Did you get it? And we'll also post this on our, just take the photo for now. And it will also be posted on our Zonta Facebook page. And if you haven't, if you're not following us on Facebook, we would love for you to do that. So we have exactly 5 minutes left. I'm going to stop the share. And would anyone care to, hello, Judith. Would anybody like to share in the 5 minutes that we have left? What are you going to do different as a result of what you saw here today? And will you tell somebody about it? And I'm not sure who posted that they lost their sister to heart disease. I'm very sorry to hear that. My daughter's been going to a cardiologist since she was 10. We have to monitor.
Hi, Teresa.
Hi,
I was
Judith.
just going to say, because I'm sitting around a lot these days, you knew I had knee surgery. So, yeah, 4 weeks ago now, it's a lot better. It wasn't that serious, like a knee replacement. But anyway, so I like the breathing one. And I really think that when I get emails or something that really upset me sometimes, I really need to sit back and just breathe and let all that go away.
Definitely.
Yeah, that's, something I thought was really good.
Good,
So
Judith.
thank you. Thank you.
Box breathing doesn't even, no equipment needed. Anybody else care to share? Anybody in this room?
I'm the one who lost my sister at 41.
Oh, Laura, I'm sorry.
Yeah. And thing that I use when I get really stressed is a rubber band. I snap the rubber band on my wrist. And that makes me focus on that, because the breathing don't help me. But that, or you pinch yourself or something, that helps as well.
Gets you out of your mind and gets you into the into the present.
Yep. So if you can get anything that brings you back, then you have to find it. Not, box breathing doesn't work for everyone. You have to figure out.
You gotta find what does.
Yep.
A lemon, because it's so startling, can also
jolt you, biting into a lemon.
Yeah, because I have panic attacks, and those are tough to get out of.
My daughter speaks of our telomeres. She's the biologist, and she said when you're under stress, your telomeres shorten. So we definitely want to have a plan in place for times of stress. And let's face it, if we live long enough, we have stress, right, Nadine? Right, Marnie? Maybe we're the sandwich generation, taking care of our parents, taking care of our family. We've experienced death of a loved one and all of that. So life happens, and we want to be prepared for it.
And don't be afraid to ask for help if you need it. If these things are not working, there's help out there. You don't have to do any of this alone.
That's true. You know, I consulted in preparation of this with CNY Access, which is available in our locality, but there's also many of them in other communities. We have Rhode Island represented here. We have North Carolina. We've got a few different states. We have Canada here. Judith, one of the videos that's on the brochure we didn't show today, it's done from Canada. It's terrific, but it's an hour long. So this place has all kinds of government funded programs available, whether you're having thoughts of suicide, whether you have a clinical diagnosis or not. They have a peer-to-peer counseling. It's just really a cool place. There was so much information. I thought we should do another whole total program on it. So our president, Marnie, would you like to say goodbye to everybody? I see we have 1 minute left. You're on mute.
Thank you, Teresa. I appreciate everybody showing up tonight to hear this message. Last year we had Karen Grossman come and speak, and she has a book about her experience of having a heart condition unexpectedly and how she felt like she would be ignored if she didn't know what the symptoms were that she was supposed to be telling folks that she had. So I think Teresa was right to say, it's important to learn the language of heart disease and to be able to describe what you're feeling in terms that medical providers will understand and accept. But I hope that you'll take advantage of all of the resources that were part of this presentation, and that you'll continue to follow what we're doing at Zonta Club of Brewerton. So thank you very much.
I'm glad you mentioned that because we've got some great programs coming up. Anyone ever wonder if what they're seeing on social media is fake news? We've got a program on how to figure that out. What else, Kathy? In April, we'll be having a fantastic presentation on plastics and introducing one of our honorary Zonta members who's done amazing things. I think those are a couple of things coming up you can watch. We'll be sharing the information out there because part of being a Zontian is to empower women outside in our community. So thank you for being here. And we are going to say good night.
Thank you.
I forgot to do a picture. You want to do a quick smile?
Oh dear.
Oh dear. Bye now. Thanks, Cheryl. Bye-bye.
Okay. Bye now.